Hi, this is Islip Town Supervisor Angie Carpenter welcoming you to this edition of Supervisor's Spotlight. And we're really delighted today to have two members of our community who have worked so hard for so many issues, especially concerning our youth. And that is Mary Pfeiffer, who's the CEO and co-founder of Youth Enrichment Services, and Barbara Vouris, who works with the agency also. And today the focus is all about drug and opioid awareness. We have a task force in town that we started in 2018, and many initiatives have grown out of that. And that's basically what we're going to talk about today. And it's all about raising awareness and letting people know that people do have issues, but there is a reason to be hopeful. There is recovery, and people can be better. So without further ado, Marianne, first of all, you've been working in the field for so many years, and but yet there's a sense of enthusiasm about what you do, and I love that. I love that about you and Yes and everyone involved. So tell us a little bit about this particular initiative about Islip Goes Purple.
Well, I think the exciting part about Islip Goes Purple is that it really brings hope in addition to awareness. But the hope that we feel, the excitement that we have about all of these great events that we've added for this year coming out of COVID stronger than ever here in Islip. Islip Goes Purple was born out of one of our task force, Town of Islip task force members, Kathy Konigsdorf, who runs the J.K. Foundation. She was in Maryland and was in a smaller town and saw this initiative going purple. Purple is the color of mental health and also substance abuse awareness. Internationally, the color of mental health is green. So, but in the United States, it's purple. Just to keep that, sometimes people get confused, a little tidbit there. But anyway, so she had brought this back to us, and I had gone to Supervisor Carpenter, and I said, I think this is something we should look into. So in 2019, Islip officially kicked off Going Purple. So we had a kickoff ceremony, we had some speeches, we had some Narcan trainings planned, and it was a great first year. We decorated Town Hall, the cupola was done purple, and then COVID hit for our following year, but we did keep it going. We did remote things, and we still kept it going. We still did the cupola. And now here we are in 2023 with amazing new events throughout the town of Islip, not just at Town Hall, not only in Sayville, but in West Islip, Brentwood, Central Islip. So we're so excited. The Ducks are joining us Going Purple. We just have some amazing events planned. And I think that the message here is Islip led the way. After, in 2020, the governor at the time then did Niagara Falls in purple.
Yep.
So bringing purple to that kind of level is an amazing thing. And now our neighbors of Babylon are going purple, Massapequa Park, Brookhaven, Huntington. I sent you the schedules.
Yep.
It's just great to see Greenport. And we're going to continue to get, maybe by next year, the county will go purple. Though I do think they want to do something at least at the county center. I hope that the county really says, let's all do this together.
Yeah.
But again, as we always say, Islip leads the way.
Yeah. Well, the county does have a tradition of lighting the Dennison building in colors for breast cancer awareness and many other initiatives. So I am sure, speaking to some of our legislators in particular, who have certainly embraced what we're trying to do here, that we'll see the Dennison building lit purple, or otherwise we'll go walking around with little purple candles. Barbara, tell us a little bit about what you do at the agency, particularly on this event and the initiative of awareness and hope.
Okay, in 2019, I joined Youth Enrichment Services as a prevention project coordinator for the drug-free community grant for Sayville, Bayport, Blue Point, and the two school districts, the Sayville School District and the Bayport Blue Point School District. I'm a retired teacher, and I was active with the Islip Drug Task Force as well. So this has been something that I've always been involved in, and as a community advocate, you know, I feel that it's very important and dear to me to raise awareness for these issues, because I did lose students when I was teaching to the opioid epidemic. So this just seemed like a natural fit when I retired. So I was here, fortunately, for the first kickoff, and I've been here ever since. So every year we just keep thinking about different ways to bring something to the community. So placemats this year are new for the diners and some of our restaurants, coasters for the bars with a QR code that goes to the Islip Goes Purple website. And working with the youth is absolutely phenomenal. We do Red Watch Band alcohol intervention training, so we're dealing with that, and we deal with the vaping, and we do some harm reduction with the fentanyl strips and the xylocaine strips now, so, and a lot of Narcan training during the year as well.
You know, these are also very important issues, and in some respects you hear about this and it becomes almost frightening. I mean, my kids are grown, but I've got 2 grandchildren, and you know, one is going to be 10, and I don't think it's too early to start talking about this, to raise that awareness. And this is what this initiative is all about. And the fact that you guys are constantly keeping it new and fresh and bringing new excitement to it, it doesn't get stale, it doesn't get old. I know later this week there's going to be a tree lighting out at Blue Point, and they have been very involved for many years. Marian, you have some information about that, don't you?
Yes, actually Barbara works closely with them, but Dorothy Johnson, who lost her son to a tragic overdose about 10, 12 years ago now, she put together Maxed Out, and she did the she got involved with the International Overdose Awareness Day, which is August 31st. So before we go into Recovery and Hope, it's more of a somber event where we light a tree purple and we remember those that we lost or who are really still in the depths of struggling with this disease.
You know, if I can just interrupt, when you talk about those we've lost, I don't think there's a person who hasn't in some way or another been touched by a senseless, as it, you know, you kind of think it didn't really have to happen.
And it didn't.
And it didn't, you know, so that's why programs like this, I believe, are so very important. But the event that's going to be held later this week with the tree lighting, as you said, I was there last year and I plan on being there again. It is very somber. It really, it really, for me, makes me marvel at the fact that someone who can have suffered a loss so devastating and so personal can take it and turn it around into something so positive as Dorothy has done, and many, many, many others that are involved.
Yeah, Dorothy, Kathy,
yes,
I mean, we're so fortunate to have these, unfortunate to have these moms and dads who lost, but fortunate that they're going to share that. So that kicks us off August 31st, where it's a much more somber event, and we remember.
Great, so we will take a little break here and go back to speak with Marian and Barbara about the Islip Goes Purple initiative. Thank you. Hi, this is your Islip Town Supervisor, Angie Carpenter. This September 30th and October 1st, please join us at the Islip Grange in Sayville for the Town of Islip Civil War Weekend. Witness Civil War camp life, drills and firing demonstrations, battle tactics, artillery drills, and field hospital visits. Attend a Civil War field church service and learn about the Town of Islip's contribution to the war effort. Don't forget to ask about Civil War sites and burial places. Prepare to be transported back in time to an era of sacrifice, courage, and resilience. So step back in time and be a part of history. This will be an extraordinary opportunity to witness the Civil War come alive. And remember, admission is free. Hope to see you there. Hi, this is Angie Carpenter welcoming you back to Supervisor Spotlight, and today we're here with Marian Pfeiffer and Barbara Vouris, both from Youth Enrichment Services, and we're talking about the town's initiative with the opioid task force, and in particular, the initiative they're working on right now, and that's Islip Goes Purple. We've got all kinds of collateral material here and posters and little cards, and we'll be sharing that with everybody, and we'll have it posted on the website also. But we were talking a little bit about the event that's taking place with the tree lighting, the fact that it's somber, but Miriam, what do you see happening there with that?
I see people bonding. We get families that they may have lost their child 2 weeks before that come.
Wow.
They're devastated, but they know that this is a safe place for them. They want to connect. They want the pain to stop, and anyone who loses anybody feels that way. But a lot of those parents and moms and dads and family members end up with beating hearts. So many different organizations, and Dorothy and Kathy, who I believe, like our two angels, have really done so much here in Islip and throughout Suffolk County for those families grieving. They're available to the parents 2 o'clock in the morning. They'll take calls. So that to me, it's a coming together. It's a realization that this is not somebody was a bad person or we should be ashamed. This is addiction. And addiction's touched all of us. And part of the recovery month is not only heroin, it's alcoholism, which actually financially costs this country more than, it's amazing, and is involved in so many accidents, domestic violence, loss of jobs. So I want to add that when we look at opioid, that's like that extreme. But those other things that are happening that we don't talk about are these kind of cannabis use,
Well, that's
overuse, and alcohol.
The cannabis use has got to exacerbate the situation, because now that it's legal, although in the town of Islip, retail sale, we chose to make the decision, and I do believe it was the right decision to opt out of retail sales and the public, hookah lounges or smoking lounges. That is not permitted in the town of Islip, although we could not outlaw the smoking of marijuana or the private growing of plants based on state legislation that was passed. And in my mind, that was very, very unfortunate, because when we were here in this very town board room discussing whether or not to opt out of the legislation, we had a number of speakers come and asked us to opt out. And one speaker that was so compelling was a teenager, I believe at the time she was only 18 years old or 19 years old, who was in recovery. And she stood at that lectern and she said, please opt out. She goes, marijuana is a gateway drug. I wouldn't have gone down the road that I did and struggled the way I have, if it weren't for marijuana. So, I think we made the right decision, but it is getting harder and harder. And I get emails all the time. I'm, got one just yesterday. We're down there playing pickleball at the courts, and kids are playing, and you can smell the marijuana, and people, just really have no respect.
And I think that there is a urban legend that we can replace opioid addiction with cannabis, and there's absolutely nothing that shows that. In fact, it can be a trigger and a slippery slope again for somebody in recovery, just like alcohol for an opioid addict to now switch to alcohol. These we have to look scientifically, not what we want it to be, but what it is. And the research is there, but there is like anything else, there is the cannabis growers want us to believe that this is the answer to everything. I am not against medical marijuana. Obviously, we know its benefits to people dying of cancer, but it is not a cure for opioid addiction. So right out there, when I see it, and this is some of the stuff that you hear, it is not true. You can research it yourself. Cannabis is a trigger. That's why it's so helpful with pain during cancer, because it is working on the dopamine sites, and it is trying to shield you from that pain and that loss of appetite. But other than that, it doesn't replace opioids. And I think, again, the same with alcohol. We have to have an awareness. When a young person or anyone is in recovery, they just can't go to bars, and they can't do every other drug but that drug. And that's the other issue that we want to raise throughout the month. There are so many levels of addiction and that we never talk about, that we're now talking about. And through this initiative, it actually starts the conversation at festivals, at places we normally don't have it. Because that's what we have to do. We did it with breast cancer when the First Lady Ford, Betty Ford, came out and said it. She did it for addiction, believe it or not, in many ways that recovery was possible, and she did it for breast cancer. And now we say the word breast. I just said it how many times? We would never think of this growing up.
Right.
And people died because of it. And it's the same thing with prostate cancer and everything else. If we don't talk about it and we don't say it's there and we whisper about cancer, and we don't get better. So I think these awareness projects are actually, despite what some people will tell you, are very successful. We know this. The federal government knows it. Awareness campaigns are the first source of prevention. We did it with tobacco. We'll do it again with cannabis.
Yeah.
Tobacco is perfectly legal. But now, how many people do you know smoke cigarettes? They'll vape in front of you, but they're embarrassed to light a cigarette in front of you. We need to get back to those things.
We absolutely do. We absolutely do. And I think with the efforts of both of these ladies, we're going to see that happening. We really, really are. We talked about the awareness in so many ways, posters and flyers, and there'll be TV spots, etc. But something as simple as placemats at the diner. Now, I think that's great. You're sitting there at the diner having some conversation, and all of a sudden the placemat's there, and it kind of can trigger that conversation that we want to have with people. And I want to take this opportunity to thank two of our diners. I mean, these are mainstays in the diner world here in the town of Islip, and that's the Peter Pan Diner and the Okanee Diner, who have both very, very graciously allowed these to be distributed, and will be distributing them in their diners along with their great food and their wonderful service. Both the Peter Pan in Bayshore and the Okanee here in Islip. So make sure you pop in and thank them for being good stewards of the community and being willing to help out in these kind of community initiatives. And it may seem kind of simple, but I think it helps get it out. Right, Barbara?
No, absolutely.
Yeah.
And simple means usually make that conversation. It's an easy, positive way. It doesn't say don't drink or don't,
Right.
imbibe in anything. Don't have a glass of wine with your meal. It's a QR code that simply goes to the Islip Goes Purple website. There's lots of resources there. There is a wealth of information for parents that might, be on the fence about, is this okay? Is this not okay? There's social host laws, there's open container laws, things that will help the community to have more of a wellness approach to their daily lives.
And I think, you mentioned parents, it's gonna be so difficult, to have those conversations sometimes, and, you don't want your kids thinking that you're accusing them, but if you suspect that this is going on, you've really got to have that tough conversation. Yeah. And I remember one time, actually I was campaigning at the time and standing outside a bagel store, and there was a long line of people. It was early one Sunday morning, and this couple was talking back and forth, and it seemed that they had sons who were friends, and one was staying at the other guy's house and said, well, I didn't have to worry about him drinking because I knew he was staying at your house. And I thought, oh my God, how can you say that? How can you say that? It was okay because it was drinking and they weren't doing drugs. Well,
Same
it's
with
not
vaping.
okay.
And vaping is the new one.
Yep, same.
They think
same
it's
thing.
healthy almost. So yes, and I agree with you. I think parents need the support to say no, and we need to let them know there are a lot of parents out there that want to be able to say no.
Well, on that note of saying no, we're going to take another little break, and we will be back with Supervisor Spotlight with Mary Ann and Barbara. Hi, this is your Islip Town Supervisor, Angie Carpenter. This September 30th and October 1st, please join us at the Islip Grange in Sayville for the Town of Islip Civil War Weekend. Witness Civil War camp life, drills and firing demonstrations, battle tactics, artillery drills, and field hospital visits. Attend a Civil War field church service and learn about the Town of Islip's contribution to the war effort. Don't forget to ask about Civil War sites and burial places. Prepare to be transported back in time to an era of sacrifice, courage, and resilience. So step back in time and be a part of history. This will be an extraordinary opportunity to witness the Civil War come alive. And remember, admission is free. Hope to see you there. Welcome back to Supervisor Spotlight. I'm Angie Carpenter. So honored to be the Town of Islip Supervisor, especially today, as we're bringing you Supervisor Spotlight with Pfeiffer, the CEO of Yes, and Barbara Vouris, who is an addiction specialist with the agency. And we're talking today about the town's opioid task force. Marianne helped me get it back on target, and I'm so appreciative of that. And an outgrowth of that in 2019 was our Islip Goes Purple initiative, which has proved to be so very, very successful. And we were talking earlier before the break about addictive behavior and how it's so tied into mental health. And I have to tell you, I am just so thrilled that, and very, very proud of the Yes Agency in particular, that you took things a step further as an agency and actually created that very physical, visible resource in the community of a mental health clinic. So talk a little bit about that and how it's there in the community and it's there for anyone.
So yes, about 10 years ago started the process of realizing that the mental health needs of our children in our community within the town of Islip was increasing.
And how forward thinking. This is pre-COVID, which I think one of the benefits.
Massive gun violence, so we were seeing it, the uptick certainly with Columbine, but yes, and even the opioid epidemic to that point. So we set about becoming an Article 31 outpatient mental health clinic as one of our divisions, and so we had bought an old dilapidated building from CDA, and we went to the state, we put in for an infrastructure grant, a competitive grant, we got it. And we built this through COVID. We do have a site here in Islip at 401 Main Street, which the town has so graciously offered a suite of beautiful offices. So we do have services local to also the South Shore. But we built this facility in Brentwood that is gorgeous and beautiful. And I'd love for everybody to see it, but I hope they only see it because they're coming to visit. But it is a mental health clinic. We have 2 psychiatrists on staff who are both bilingual Spanish speaking, and about half of our social workers are also Spanish speaking because we know the need, especially when we're dealing with parents. And we really tackle before we get to the substance misuse. So we do the early intervention. We're seeing a lot of vaping, a lot of cannabis use. But again, anxiety is a huge predictor of people that might fall prey to addiction. Anxiety is one of them, OCD, obsessive compulsive, where once they like something, you know, when you have that sleeve of Oreos, I'm fortunate, I can eat half the sleeve, but I see people who have to eat all of it. And you can see that whether it's food, gambling, it's dopamine sites. It feels good. The brain says, I like this and I want more. And that's really what addiction is. I mean, it's 25% really about DNA. And so if you have that precursor, you should really be careful, but it's really about environmental factors. If you feel a lot of stress and a lot of anxiety, your child is, and they keep telling you, I have stress, do not say to them, you don't know what stress is. Now, granted, we know there's a difference, but for a 10-year-old, becomes 11, 12, he's going to find a way to deal with his stress. So we have counseling services. They're available to anyone, ages 5 to 21. We work with not only the children, but the families are part of it.
And that's important because it's a team effort.
And if the families need services, we get them, the services. So that is one of your best, when you see that initial use that's beyond experimentation, and you have to open your eyes, and lots of resources tell you when you know you're beginning to have a problem, get them down there, get them somewhere. We're not the only resource. There are lots of resources, but certainly, yes, focuses on ages 5 to 21. We have immigrant families. We have families that are in upper middle class communities coming in because our clinicians, only focused on children and youth, and they are incredible. the work that they do. We work with Northwell South Oaks. We work with Good Samaritan Hospital when we have a hospitalization from whatever might be going on. So I can't tell people enough that there's no reason for addiction if we do the prevention and the early intervention. We can spend a lot of money after it, burying people and everything else,
God
or we
forbid.
can get more in tune, and the school districts are getting on board with this. So I think it's really a positive time that through bad circumstances, opioids, DWIs, and certainly gun violence. Again, I'm not going to get into the gun violence disagreement, but what I can tell you is most people who engage in these acts, whether it's knives or guns, are struggling with mental illness. And so that to me is important for us to keep in that conversation. But we have so many great events going on too that are going to be part of this kind of thing, and different events if you wanted to go into them.
Well, yeah, I'll let
Okay.
you do that, but also too, at all of the fairs and festivals, more times than not, you'll see yes there, and it's a non-threatening environment, and people will walk up and they'll start that conversation, and from there, the opportunity to take it a step further is so much easier than it might have been
And
otherwise.
all summer long, Islip Goes Purple tent
Absolutely.
is up there, so we start bringing people's awareness back. We have a plan to do something each month, but that's, of course, with that new opioid money coming out of the county to really bring different issues each month and highlight them and really go after them that surround opioid addiction and all addiction. So we have these events. So we have that somber event. So we have the kickoff here at Town Hall on September 6th, and we actually have a color walk run. Nobody's running. And you go through and we spray you with purple powder. And the reason is it's joyous. Recovery is something we can rejoice in and know it's possible. To give people hope. Because if there is no hope, then we have another problem going on. So I think that that's just such an amazing kickoff. And then we go right into...
That has really grown. And in the first year that we had at Campbell's Bakery in Brentwood, and I want to do a shout out to him. He's just so gracious and generous, and he came down with purple cupcakes, and the kids loved that, and the adults too. But it was a fun way to kick it off.
And we just keep adding things to make it really something that as a family come down and enjoy.
Purple sunglasses.
So that's at 4 o'clock, actually 3:30 be down there. And then on the 15th, we have Vibe and Thrive in Brentwood at our brand new mental health clinic, which really talks about alternative things. We're going to, talk about acupuncture. We're going to talk about yoga. We're going to have spoken word. We're going to hear from people that have been through it. We have a lot of different things planned. It's very exciting from 4 to 7 on the Friday afternoon. We'll have some tasty food as well. Come on down for that, and some entertainment and some music. It's going to be kind of like a spa day for mental health and recovery. And then on that Sunday, the Ducks, thank you to the Long Island Ducks, they're going purple. So we have 200 tickets. We're going to have our purple shirts on. The Central Islip School District is going to have their cheerleaders there in purple because they're purple.
Yeah, that worked
and we're
out
going
well.
to have the choir, the Reed Middle School Choir is going to sing the national anthem.
Phenomenal.
And we're going to see Islip Goes Purple at Duck Stadium. That's on the 17th. Join us. Come down and support the Ducks. Hopefully next year we want to get them to wear purple, but that's a big ask. We'll get there.
I have to say, when I reached out to Frank Bolton, who's a Town of Islip resident, and we're so glad that the town is home to the Long Island Ducks. But when Marianne first threw the idea out and I reached out to him, he did not hesitate. I said, well, what about a table there? Not a problem.
And we know that sports deal with addiction.
Absolutely.
So the support, and he lives in this town. And then our other final event is our Healing Strides on the 23rd, right here at East Islip Marina, our own walk for recovery. And that's with Beyond Sober. And we're so excited to have Brentwood's own Herbie Medina leading the way and talking about his own recovery and his life's choices, and how today he has made the choices that he's made. And I just was there today. We are so excited about our own walk. We don't have to go to Jones Beach.
No, we don't.
And that marina is beautiful. And that is on Saturday the 23rd at 10 a.m.
And then the one thing, and we do have to wrap up because we're running out of time, but on the 30th, the Jay Konisdorf Foundation Zombie Run at Heckscher State Park. And, really she's done a wonderful job. And
that is a fundraiser to send people to treatment.
Yes.
So if you want to
You heard it
contribute.
here, and as you can tell, a lot of excitement, a lot of enthusiasm, and please help us get the word out. There is reason for hope. Thank you so much for joining us on Supervisor Spotlight.